Good afternoon, everyone. Welcome to today's webinar on construction leadership skills for managing stress during the COVID-19 pandemic. I'm Cain, Executive Director at CPWR, and I'm pleased to kick off what is now our 12th webinar in the CPWR NIOSH bi-monthly COVID-19 webinar series for the construction industry. Before I introduce this webinar, I wanted just to mention that CPWR continues to populate and update our COVID-19 clearinghouse. We'll post a link to that in the chat box, as well as our planning tool. The planning tool allows employers to develop a written COVID exposure control plan, and over 150 plans have been created so far with the planning tool. We're keeping that updated as the information and guidance changes from the federal government, including CDC and OSHA. So please check back often, and we'll keep those sites populated for everybody. As we all know and have experienced by now, COVID-19 has created new stresses for construction employers and their employees. Our presenters today from the Center for Health, Work, and Environment at the Colorado School of Public Health will share what the pandemic means for leaders' personal health and effectiveness, and skills that leaders can use to manage stress related to COVID-19, and resources to identify and help workers experiencing challenges. Our first presenter, Dr. Lee Newman, is a researcher, physician, public health practitioner, and educator. He is a University of Colorado Distinguished Professor in the Department of Environmental and Occupational Health and Epidemiology at Colorado School of Public Health and the School of Medicine. He is also the founding director of the Center for Health, Work, and Environment, co-founder of HealthLinks, and co-directs the Colorado School of Public Health Certificate in Total Worker Health. We will also hear from Dr. Natalies Intro, the University of Colorado Assistant Professor in the School of Public Health Department of Environmental and Occupational Health at the Center for Health, Work, and Environment. Her interests and research are in leadership and climate for the workforce health, safety, and well-being, including work regarding safety leadership in the construction industry. But before we get into their presentation, Dr. Scott Earnest, Associate Director for Construction in the Office of Construction Safety and Health at NIOSH, will provide a brief update. Scott will also be moderating the questions and answers at the end of today's webinar. I'll hand it over to Dr. Earnest.
Okay, thank you, Chris, and it's great to be with everybody. Just had a number of updates I wanted to provide from the Center for Disease Control. First thing I wanted to mention is that since the pandemic began, there have been approximately 225,000 deaths that have occurred across the U.S. Also, the CDC has updated their definition for exactly what a close contact is. Basically, they've changed it so it now applies to cumulative 15-minute exposures over a 24-hour period. And the reason they changed that was based upon some research that was done in a prison in Vermont where prison guards were interacting with folks that had been exposed to COVID but were asymptomatic, and they were exposed for very short periods, 1 or 2 minutes, but it was extended over an intermittent exposure over a 24-hour period, and they contracted the disease. So they've changed that definition. The other thing I wanted to mention about related to travel, CDC has updated a fact sheet on their website about hotels, resorts, and lodge workers. And then they've also updated a web page entitled Know Your Travel Risk, and it gets into issues related to travel, food, lodging, camping, and then it has information about things to consider after you travel and additional resources. So that's the update I have for today, and with that, I will turn it over to Dr. Newman and Dr. Schwatka. Thank you.
Great. I want to thank you, Scott, and thank you, Chris, and our colleagues at NIOSH and at CPWR for inviting us to meet with you all here today. So what we'd like to do with you here today is to talk about, in the construction field, leadership skills for managing stress during the COVID pandemic. And this is not an easy one, and we're not going to pretend to have all the answers, but we think that we can point you towards some sound directions to go with your thinking as leaders of teams, whether you're a foreman, whether you're a coworker who's influential with other groups of workers, whether you're in senior management. Just real briefly, our background, as mentioned, we're at the Center for Health, Work, and Environment, the Colorado School of Public Health, where we share the same mission that I think you all have, which is to advance worker health, safety, and well-being. And with that, let's go ahead and let's dive right into this tough topic. What we're going to cover today will be, in part reflective of some of the questions that we've received. We'll field some more during this session, but we'll start off with some context and some background for you around leadership and what COVID means for construction leaders' personal health and effectiveness, skills that effective leaders can use to manage stress related to COVID, and we'll be pointing you to resources to help identify and help workers who are experiencing stress and mental health challenges. The construction industry has good reason to have concerns. What we're going to focus on here will be identifying some of the sources of stress and the factors that aggravate mental health conditions, how to identify those challenges, and some suggestions on how to take action. The context that I want to put this in is one that is now increasingly widely understood and shared and taught in all kinds of leadership trainings, and it's this concept of self-care, of self-help. And if you think about the times you've gotten on an airplane, maybe you haven't done that recently, I haven't recently, but when you're on airplanes, what is that message? The message is always, if the oxygen mask drops from the ceiling above, put on your mask before helping others. Now, if I could get a show of hands, I'd find out that most of you would go like, no way, I'm going to help the person who needs more help right next to me. But there's a reason that they tell you to put on your oxygen mask first, because if you become incapacitated, you're no good to yourself and you're no good to anybody around you. So put on your mask first. This is our emerging leadership paradigm. And it has, in fact, double meaning for us today because of COVID. Putting on your mask first, taking care of your health sounds in other times very selfish, but more critically than ever, if you're a leader, people are counting on you to be fit and able to perform your job. And the other mask image is wearing your mask to help protect yourself and others from spreading COVID and keeping your business up and running, keeping your coworkers and yourself and your family safe. So this is our leadership paradigm today that I want to emphasize. And so there's a reason that we're going to start off by thinking about you and your health and well-being before we even launch into the rest of the discussion. We like to think of this as being a kind of well-being bank. There's an opportunity for you to be making contributions to the bank, and deposits of the bank are the things that help build your resilience, build your capacity to handle the stresses that you already had even before COVID, as well as being resilient enough to handle what's coming at you right now during COVID. The flip side of this is inadequate. If you have to borrow, if you have to go into debt, sometimes into bankruptcy, by having less resilience because you haven't addressed some of the ways in which you can improve your well-being, then it's costly to you, and if you're in a leadership position, to the people that you work with. We like to think about this, and there are many different varieties of the well-being wheel. And as I briefly go through this, what I would like each of you to do is to think about one of these areas where you can, effective immediately, pick one of those to try to add to your well-being bank. And we can start with, over on the right, let's start with good nutrition and exercise. And sometimes we think, oh, well, I work in construction. If I'm out on a job, I'm getting exercise. It's actually not the same kind of exercise. There's still a need. I think we underestimate what our needs are for regular exercise and for good nutrition. In fact, there's even data showing that when it comes to stress, having a more balanced diet is contributing to our well-being and reduces stress. Relationships with family, friends, and community. This is strained right now because of COVID. We're not having the same amount of interpersonal contact, and there's starting to be some pretty good evidence that as people are more isolated from family, friends, and community during COVID, that's an added stressor for them. So finding ways to enhance that, even by small degree, could be beneficial. It seems weird to talk about creativity and play right now. This may not be an area where you place emphasis, but we do know people when they do have some downtime are finding ways to unplug and maybe find opportunities to pursue other kinds of activities, including intellectual stimulation. Maybe it's reading that book. Work, finance, and career, I don't even have to explain the core value of that to you in terms of your well-being, but I do want to take a moment on the last two, spirituality and sense of purpose. When we say spirituality, it can be religious for some people, and for others, it's not necessarily religious. It's more about finding meaning in the things that you do in your life and things that you can do to enhance that sense of meaning in your life. Again, even in a small degree, is going to be beneficial for your overall well-being. And lastly, especially in the construction trades, I want to emphasize in terms of adding to your well-being as well as to your productivity and your safety on the job, the importance of rest and sleep. And we'll come back to that in a little bit. I would love it if each of you would make a commitment to find one of these areas in which to add to your self-care. There's a reason why this is so important. We're all under stress, and you know the funny thing about stress is that people will often talk about it and go like, well, stress is good, and actually stress and stress hormones can be, to a certain point, restorative. They can actually be healing the body, but that at some point the effects are damaging. And if you look at the amount of pressure that someone has in the work that they're doing and call this kind of your stress line here, compared to your performance, there's a period where there's sort of a part of the graph where if you have very low pressure, very low stress, actually you may be bored, you may underperform. There's an ideal area where there's best performance, but then when you reach a certain crossover line, and it varies for each of us where exactly this line is, performance starts to fall off because stress, anxiety, and happiness are rising. And there's a big relationship between how high the demands are in our work and how much control we have over our work that drives us to feel high stress, high pressure, anxiety, and then our performance in both physical and cognitive tasks starts to go down, and COVID is compounding these effects. And so when we talk about managing stress, we're good with people being in a range of stress that is performance enhancing, but when it crosses over to the high stress area, performance declines, and it actually starts having health effects. So we would refer to that as actually going from stress into strain with physical and psychological consequences. You can't keep revving at this level, or you know that the engine is going to be damaged. And that's the image that I think we really need to embrace. Whether you're now working from home, working remotely, working longer hours. The average person right now during COVID is working almost an hour more per day than they were before. Or if you're out on a site, you can't keep performing at this peak level for the duration of the pandemic. So people have to figure out how to pace themselves. Natalie, shall I go through the stress process here a little bit further? Okay, I will. So the stress process, as I mentioned in that previous graph, there are a variety of stressors. And then there are the stressors that, when they reach a certain crossover point, become what we call strains. There are also, very importantly, buffers that help mediate this process. And a lot of this comes out of the psychology literature. Before I went into medicine and went into public health, I did my graduate work in social psychology. And these were things that we even understood way back in those days, back in the 70s and 80s, and the literature on this has just become even scientifically stronger over time. It's important that we talk a little bit about each of these, and so we'll do that for just a couple of minutes, because I think that's where we get a chance to understand how this applies to you and to the people you work with. So let's talk about the stressors first, and Natalie, you're going to chime in with me here as well as we talk about some of these as they apply in construction. Here's a list of some major stressors, and there's a range of them, and some of them may affect some people more than others. But let's think about the ones that probably most commonly are in play in the construction field. There have always been high job demands and high workloads. There have always been economic stressors. There's always been precarious employment and the risks of job insecurity and unemployment, and potential for work and family conflict over the kinds of hours, the shifts that people are working, and the stresses on the job, as well as at home, our financial as well as family stressors. I want to come back up to the top right here, though, because lack of control over work combined with a physically demanding environment and having high job demands, this triangle in the world of construction, if you were going to find some way to try to reduce your stress and the stress for people around you, you'd work in this area. And if you're in a leadership position, you have the potential to be both a positive as well as a negative influence on the people on your team. So, for example, there's actually pretty good data now that, depending upon what you think, if you're an employee, whether you think your boss cares about you or cares about your health, influences the likelihood of you ending up having a work-related complaint of back pain, and how bad that back pain is, and how long it lasts. So there are lots of physical manifestations. We as leaders can actually cause people to have high blood pressure and worse cardiovascular disease, heart disease. So leadership can be an important stress factor here, both positive and negative. And finally, in the time of COVID, threat avoidance is itself a stress. So what do we mean by that? Just the effort of going like, has that person kept 6 feet away from me? How do I do this task in construction without being close to other people? Some of them are impossible, right? You can't do your job and be 6 feet apart all the time. Are people wearing their masks? Could somebody be asymptomatic and be a potential spreader of COVID and I don't know it? There are lots of things that go into people's thinking right now around threat avoidance, which has elevated it on the list of stressors. Natalie, I was going to ask you if you have things that you want to add on this part of the stress process on the stressor side.
Yeah, I think in construction, the backdrop of what work looks like in construction, where you're on job sites for a short amount of time or a long amount of time, you're working with different kinds of contractors all the time. Different rules around COVID could be really stressful depending on what job site you're at. Working with diverse members of your crews and the crew dynamics of who your foreman is for the day. So I think the context behind how construction work happens can really play into these stressors as well.
So if you think about these, and you all will have access to these slides, if you can think of any one of these that you can reduce it, that's a place to focus. And I want to mention just real quick before we move on, lack of control over your work. It turns out that even if your job demands have stayed high and they haven't changed, if you can give people on your team just a little bit more control over how the work is done, any kind of flexibility, any kind of input that you can give them, it turns out that's a big impact on how much people are affected by the stressor. There are the strains. So the flip side is what happens if you fail to control stress and people start having the consequences. And I'm not going to go into all of these. I think that you've probably all seen them and you're aware of them. The ones that we'll come back to today, we're going to talk about the issues around mental health and suicidality, because we know what a big issue the whole subject of mental health, depression, and suicide is in construction, and it's actually a national tragedy that continues to plague the industry. Substance use, sleep problems. You can go down this list and understand why we're emphasizing the issue of managing stress. And one of the ways that we do that is by thinking about, well, what are the things that reduce stress so it doesn't go to strain? And here, as leaders, is your home run. If you're going to impact the health and well-being and the stress levels of people around you, lies in one of these boxes. As I mentioned, flexibility is important, and I know we got jobs to do and we got to get them done, and there are deadline pressures, but even again, small amount of flexibility about how the work gets done can make a big difference. Being able to match people's work to their abilities. This is a time where there are a lot of people coming to work who, if they weren't sleep deprived before, they're sleep deprived now. And they may or may not be able to perform at the level that you expect. How do you as a leader identify whether people are struggling on the job? You can certainly reflect on these. And Natalie, again, I'm wondering if you want to weigh in on some of these buffers as they apply. And I know from your research, you have quite a bit to say about this.
Well, yeah, I mean, like the one that stands out to me is flexibility. I mean, it would be nice in the industry to have some flexibility about how, when, and where you do your work, but that's not reality for how things happen in the industry. There are deadlines, there are rules, there's a process that needs to happen from start to finish to get the build done. But there are ways to build in flexibility, and I think that's where leadership comes in to sort of, at the most minute detail of planning the tasks for a day, people can still have an opportunity to be flexible in how they at least do things throughout the day. And that little piece of ability to have some control, like we were saying, over how to do things can really be a stress reliever.
And I think that you're going to come back to some of these in this next part of the talk. So the broad question that we really have, if this is kind of the lay of the land in terms of how stress can affect the performance and the psychological and the physical well-being of people on your team, we need to switch over to ask the question: how can you step in to reduce your stress and that of others if you're a leader? One last point that I think is important to make is that we mentioned earlier about sleep, and I think especially in the kind of high pressure, often odd hours that people face in terms of doing construction work, is to understand the connection between stress, sleep, and work-life outcomes. And I want to thank our colleague Gwen Fisher, who is an occupational psychologist at Colorado State, who's taught me a lot, along with her colleagues in the field, about this interconnection. And it's something that I want people to bear in mind, which is that if you are fatigued, it reduces your ability to cope with stressors in a healthy way. So we have our regular job stresses, our life stresses, and our financial stressors, and now we pile on the COVID stuff. If people become fatigued, they're not going to cope with those stresses in a healthy way. The inability to cope with stressors itself disrupts your sleep cycle, and disrupted sleep increases your fatigue. Now, what does this mean in construction? It means that if people come to work fatigued and lacking sleep, we already know they're at a higher risk for injuries. There's a higher risk for fatalities. As far as their teamwork and their ability to engage in safe behaviors, all of those are going to be affected by that. And Natalie, I'll give you a chance to weigh in on this topic as well.
Yeah, I think I can get into that. I mean, in a few minutes, I'm going to be talking about why are we talking about leadership in the context of health and fatigue? And I think leaders can be one of the big sources of stress in one's life, and you could lose sleep over your relationship with your supervisor. And so that's why it's important to address leadership in this context of health and stress.
And by the way, if even before COVID, if I could know one thing about the people on my team at the start of a shift, it would be how well did they sleep last night? Because we also know that your physical performance and your cognitive performance is affected by how many hours of sleep you got. And when people get less than about 7 hours on average, then it compromises their ability to do the physical tasks and the mental tasks of their jobs. So now that we've talked about the importance of putting on your own mask first, I want to turn it over to Natalie to continue and apply this to the situation that many of you find yourselves in.
Excellent. Well, hi, everyone. First, I'm going to apologize. I have a cold and it's affecting my voice. So if I sound funny or if I go out completely, I'll just pass it over to Lee and he'll take over the slide. I should be good, though. But I'm so happy to be here today talking to you about this topic because I think that, especially in the context of COVID, it's so important for leaders to first put their own mask on first and attend to their health. Because as I'll talk about, leading by example, modeling the way is one of the key tenets of being a good leader. And so now that we've got that out of the way and we've learned from Lee about how important it is to put your mask on first, both literally and figuratively, I want to talk about two things. How leadership skills can be used to help crew members manage stress, both in terms of the job site protocols that are now happening for COVID, but also in terms of all other stresses that workers may be experiencing. So over the past few years, I have been fortunate to be a partner with CPWR on a safety leadership project called the Foundations for Safety Leadership. And in this project, we learned a lot about what it means to be a good safety leader in the construction industry. And I think a lot of what we learned there can be applied to the COVID situation that we find ourselves in. And there are many styles and practices of leadership out there, and the ones that are listed here reflect ones that are important for the construction industry. The skills represent key activities that leaders on job sites should be doing to make sure that their crews are healthy and safe. And it starts with what Lee was talking about, leading by example, literally putting your own mask on first and being that role model. But it also includes things like engaging and empowering team members, making sure they have a voice and are empowered to take action to protect their health, using communication skills to have a conversation about health and safety practices, and use active listening skills to make sure that they're understanding what others are saying, using coaching, teaching, and feedback, making sure that folks understand how to be healthy and safe through coaching and giving them feedback and observing them and making sure they just understand things. And then finally, what I think is really important is recognizing team members. And this is something in safety leadership trainings that I've been involved with in over a number of years, is one that's so easy, yet so often forgotten. We often forget to thank people for being safe on the job, and that's a key leadership skill here. So how can leaders apply these skills to our current situation we find ourselves in? I think it's first important to think about it in terms of job site COVID protocols. And there are two key points here. The first one being that the job site leadership of COVID protocols is just as important as the COVID protocols themselves. Crews are looking to their leadership for how to act during COVID-19. When crews have leaders who are good role models, they're following protocols, they're wearing the mask, they're doing social distancing, crews will see that as a cue that that's important to the organization. It's important to do on the job site, and they'll be more internally motivated to participate in the COVID protocols. And honestly, this takes a lot of stress away from the ambiguity of whether they need to be doing those COVID protocols on a daily basis, even when the work scheduling becomes demanding. And the second point here is crew engagement. So engaging crews in the protocol development of these COVID protocols and implementing will give crews a sense of ownership over them. And it gives them motivation to participate, and it gives them more motivation and drive just to participate in the protocols. So what are some specific examples of ways in which we can apply these safety leadership skills as it pertains to stressors around COVID protocols? First, and I think this is really key, job site leaders have to have a positive attitude about them. I know that it adds a lot of stress to doing work on a construction site to have to now wear a mask, now have to figure out how to social distance in spaces where it's really hard to do so on a construction job site. But as long as the leader in the situation has a positive attitude, that's going to give people more motivation to actually participate. Crews must feel okay communicating about leadership, about their stressors related to protocols before they lead to the strains that Lee talked about, like job demands, workload, lack of control, et cetera. And a way to get crew buy-in for COVID protocols is to engage them, involve them in developing the protocols, get their input, get their feedback. Again, that gives them sort of the motivation to participate if they have a say in it. And I think crews are going to have a lot of questions and concerns about protocols. And part of good leadership is actively listening to what people are saying about it. And using those active listening skills to really pay attention and understand what people think about them. Part of this is also taking the time to observe crews and give them feedback on how they're using the protocols. Maybe they're not wearing their mask because they don't, or they're not wearing their mask correctly because they just honestly don't understand how to wear a mask. Well, you won't know that if you aren't engaging with them and talking with them about that to make sure that they actually do understand. Because it may be that they just don't know that the mask needs to go over the nose. They never knew that. And then finally, coming back to that recognition piece, thanking people both individually and in larger groups as appropriate for following the protocols, making sure people understand the connection as to why it's important to keep the protocols, to keep people healthy and safe, and so that everyone can continue to work and get the job done. So crews are experiencing stress with some of these changes, and leaders must be attuned to their crews so that they can respond accordingly and triage them into resources as needed to take action. So as I mentioned, crews are experiencing stress due to new COVID protocols on the job site, but I also think that COVID is impacting life outside of work. So there's probably also stressors that are emanating from their home lives as well with their families and community and whatnot. So the reason why people may be experiencing stress during COVID is likely not just because of what's happening at work, but it's also what's happening outside of their lives as well. And at times that can come back into the workplace too. So as leaders, it's important to be observant of these. And what I have listed here are just some behaviors and things to look for to learn whether someone may be struggling a little bit in terms of, maybe their physical appearance is changing. They don't have as much energy anymore. They've lost weight or they've gained weight. Maybe they're more tired than normal. And what about their mood? Are they more irritable or anxious? Do they have more emotional reaction to situations when talking with other people? Do they feel overwhelmed? Changes in behavior. Maybe they're not as social as they used to be. They don't find enjoyment out of things that they used to find enjoyment out of. And maybe they're not performing to the usual standard. And then finally, are there changes to their expression? Are they thinking about situations negatively? Are they personalizing situations? Do they believe everything is terrible? So these are just some of the warning signs that you can look for individuals who may be experiencing a little bit of stress and trouble, and could be cues for you to step back in with those leadership skills I just talked about, to engage them and communicate with them and ask them if how's it going and do they need help. So how can leaders identify and help employees exhibiting stress? So think back to the stressor strain model we just showed you. As a leader, you should be identifying employees that are stressed and working with them to figure out what buffers they need help with to make sure that it doesn't lead to the strains that Lee talked about. So I think, again, the thing here is being present and engaged with people that you're working with, taking time to talk to people individually, one-on-one, as well as even maybe as a group. Maybe crews can be talking about this as a team, if that's appropriate. These can be frequent check-ins, asking things like, are you okay? Listening to them, maybe recognizing that you're not going to have all of the answers, but you're there to listen and chat with someone. from their perspective. And I think some of this is empathy comes into play, just being able to understand the person's stress from their own point of view. And then it's really important as a leader to help them take action. And so there may be some buffers that you have within the company that you can make use of. Maybe you have stress management programs. Maybe there's healthcare resources. Maybe there's some flexibility policies that may be able to play. Or maybe there's some resources out in the community that you know of or that you can research and help people connect them to and help them just take action. So there's, obviously we can do a long talk on this, but I just want to mention a few other resources that are out there that may be useful for this. CPWR a few weeks ago did a really nice webinar on mental health during the COVID-19 pandemic. If you're interested in this topic, I encourage you to watch the whole thing. There's some really useful resources there on how to identify crews who may be, again, experiencing mental health challenges and strategies for getting help. They also have a nice website on mental health and addiction, with also some resources on there about suicide, which I think deserves its own webinar and one that we can talk about doing in the future and dedicating a whole webinar on this because it's a serious concern in the industry. If stressors remain unchecked and there are no buffers, a lot of times people may contemplate suicide, and that's a real issue in the industry and something we need to address. So OSHA has some resources. The American Society of Safety Professionals has some resources. At our Center for Health, Work, and Environment, we have a suicide prevention training online that you can take virtually that may be useful. I also, just to start concluding, I want to mention that if you're interested in continuing on this journey of leading for health, safety, and well-being, at the Center for Health, Work, and Environment, we are hosting a virtual leadership training for the construction industry in November. We'll be talking about these concepts around putting your own mask on first, but also talking about how to create a business strategy for health, safety, and well-being, and how to address the culture of health, safety, and well-being in an organization, and talk about how to set some industry-specific goals around this. So if you're interested, I encourage you to sign up. So to recap, I think it's pretty clear that we truly believe that leaders need to put their own mask on first, both literally and figuratively, and make sure that you're attending to your own well-being bank. And at the same time, leaders can use the leadership skills I mentioned, such as leading by example or using active listening skills or empowering crews to help them manage stressors they may be experiencing during the pandemic, and working with them actively to help them identify ways that they can take action to reduce those stressors. So I want to thank CPWR for hosting this and NIOSH, and just thank all of the people that have helped us create the content that we have talked about today, from the University of Colorado Anschutz, Colorado State University, CPWR, and University of Colorado Boulder. And our contact information is here, and if you have any questions, just feel free to shoot us an email, and we'd be happy to chat.
And we're really happy to have the rest of the time here to be fielding questions that you folks have. So, Scott, if you're going to help direct us to the questions, we're happy to get on with that.
Absolutely. Thank you, Dr. Newman and Dr. Schwadka. And we did receive a small number of questions through the registration process, so we'll begin with those. And then folks online, if you've got other questions, enter them into the chat, and we'll touch on those once we've addressed the ones through registration. So the first question is, how can managers effectively overcome the suck it up mentality in construction? I've heard that it's been difficult to get workers to wear their mask, and imagine mental health may pose even more of a challenge.
Natalie, you want to take that first?
Sure. I think, I think that a lot of people, regardless of whatever industry we're talking about, that may even be a challenge. But I think it's a lot hard for a lot of people to do what Leah was talking about, how, putting your own mask on first. But I think as leaders, we need to have a long lens conversation about why leadership is a value and that it matters. And I think that what I think can be really helpful in those situations is for the leader, maybe that's actually the formal leader, or someone who maybe isn't even in a leadership role but wants to stand up and speak, but tell their personal story about why health matters to them. Personalize it. And I think those stories are more compelling than someone just saying, we need you to wear your mask to be healthy. Well, why do you need to wear your mask to be healthy? Well, it matters because I have a family at home and I want to go home to them and I don't want to bring COVID home to them. So I think personalizing it may help in that situation.
Integrating, a topic like that into a toolbox talk is a very logical place to be reinforcing both safety behaviors as well as these health behaviors, which frankly for COVID is also a safety behavior. So here's the thing that's so strange right now. We think a lot about, like even though we have a suck it up and just get the job done mentality, we're trained now to say, yeah, but do take the time to put on your hard hat, to wear your goggles. If you've got to wear a dust mask, wearing your dust mask, right? And so there's already a culture that's developed in construction for taking the time to do the job safely, because we all know what happens when that breaks down. Well, this is one more piece of that same story. In this case, the strange thing about it is that, frankly, it's unusual for your coworker to be the safety hazard. And a coworker who's not wearing their mask, and if you're the worker who's not wearing your mask, you actually present a safety threat to the other people on the job. And that's a different dimension. I mean, the only other place where we probably run into that kind of thought process is when you think about people who come to work impaired, and because of their impairment, they perhaps they lack sleep, or they have a substance use disorder that's not recognized. They could actually cause harm to other people on the job. Well, this is sort of a corollary of that, isn't it? So it's starting to have people understand that keeping each other safe is part of our job during COVID.
Absolutely. Okay, thank you very much. Let's go ahead and move to the second question, which is, are there effective ways to communicate the updates from both the government and from the company you work for on COVID issues to the employees? Is there a best practice or a best way to do that?
Yeah, so this is embedded in most of what Natalie talked about is the word communication, right? All of this engagement that we're talking about, all of this education we're talking about comes back to communication. So here's the problem. The problem is that we're getting mixed messages. We have lots of different voices out in our community, even within our government, who vary in terms of the kind of message that they're giving us. There may be different messages coming from corporate compared to what's happening, there on the job. And the second part is, so not only are people, who are supposed to be in authority giving us different messages, but the message has to change because we don't know everything about COVID. Right, so Scott, you started us off today, and all of a sudden, we now know that being 6 feet apart and less than 15 minutes is not good enough. Somebody could be closer to me than that for less time than that, or even 6 feet away for less time than that, and they now are, a potential risk for me. It's cumulative exposure to other people who could be asymptomatic carriers. So the information is changing really fast. And that leads people to lose confidence and be discouraged about what's being told to them. How do I know what the right thing to do is? I think we all have our own strategies, but here are some general principles. First of all, be transparent. This is what we know, and this is why we're agreeing that we're going to tackle it in this particular way. So collaborative and transparent. The second thing is to, as part of that transparency, tell people that there still is uncertainty, so we're going to take extra precautions. Right? I mean, think about how often on a job does somebody actually, have, go like, wow, I'm so glad I was wearing my hard hat today. A lot of the time, nothing happens, right? But it's there for a reason. So having people come to the idea that that we're going to have consistent practices, that that you may think today are more than you need to keep yourself safe, but we're going to do them anyway because there's uncertainty. So those are important parts. And then at the end of the day, I'll even say to people, whatever else you're hearing, when you're on this job, this is the way we're going to do it until something changes, and have people buy into that and stick to it. So those would be the basic principles that I would go with.
Okay, thank you very much, Dr. Schwaka. Did you want to add anything, or are you good with that?
No, I think we did a great job.
Okay, and then one other question that came in through the registration, and that is, if you have a situation where an employee is refusing to wear their mask, what's the best way to handle that? Is there some sort of process or procedure? How strict should you be about that issue on a construction site?
Mm-hmm. Yeah, I mean, that's definitely a tricky one. But I think there's two parts to that question. The first part is if wearing a mask is part of complying with mandated safety protocols on the job site, then you may need to think about, what are the consequences of not following other safety protocols, and how you can apply that to not wearing masks. So think about what your current level of discipline is for not complying with safety rules in general, and apply that to mask wearing. But I think, as it pertains to what we're talking about today in terms of leadership, people aren't wearing a mask for a reason. And I think as much as you can as a leader to bring mask wearing back to the organization and the team's mission and vision and values, which can take a long time to get by in using that, but it's really effective. And getting people to understand why wearing a mask ties into getting the job done, being healthy, going home to your family every day. And if your company values, I'm guessing a lot of companies value providing a quality product to their customer. You can't do that if your workforce is getting sick with COVID because they're not wearing their masks. I know a lot of construction companies have values around family, and if you value family, then you should be wearing your mask to protect your family from COVID in case of the event that you're exposed at work. And so again, coming back to communication, talking about why this matters for getting the job done, why it matters for you being able to continue to work every day, those kinds of conversations are going to be more effective in the long run in ensuring compliance. But again, you could probably think back to, what are HR consequences for not following safety protocols?
Okay, great. Thank you very much for that answer. Here's a number that have come in through the chat. Let's see here. Just wondering if there is any acceptable level of mental stress. What would be the most critical, sensitive mental stressor for COVID-19 in construction?
So I'll take part of that, and Natalie, maybe you have something to contribute as well on the construction side of it. First of all, we all experience stress. It's a normal physiologic response. It's associated with release of certain chemicals, certain hormones, activation of our sympathetic nervous system. So, so we're all experiencing some level of stress pretty much all the time. And each of us handles that in different ways. So coming up with a clear answer of saying, this is how much stress is okay, and this is how much mental stress is not okay, is individual, situational, and even varies depending upon the kind of circumstance you find yourself in. So there's not a clear answer to that. I'm giving you a real waffly answer because there's not a simple answer, except that if it crosses over into certain kinds of behaviors and health problems, then you know that it's gone too far. If performance starts to drop off, if people start missing work, if they're consuming more substance, if there's more substance use, if they're starting to experience high blood pressure, worsening of diabetes, there are lots of strains that result from it. trying to figure out where that line is tough for me as a leader to know about you as an individual unless I ask you for some indicator of how you're doing. Natalie, do you want to tie that into, is there a number one piece that you would have to say is most important from a construction standpoint?
Well, I mean, I just generally, I think stress is in the eye of the beholder, and you can't assume that, you know, a high level of stress for one person is the same quantitatively for the other person. And so I think that's why, you know, using these leadership skills, again, communicating, knowing people's limits is really important. And getting to know everyone on your crew, you know, if you're a foreman or superintendent.
Okay, very good. Thank you for that response. Here's another comment. I don't know if it's necessarily a question, but you may want to comment on it yourself. Kenny McCleary says, there is an element of fear and dread, even a fatalistic mood due to all the bombarding messages of grim milestones. Dread shows up as avoidance behaviors, but are there other unique impacts we need to be managing due to fear and dread? So I guess that is a question. Are there other avoidance behaviors that we need to be aware of and manage? Because just all the concern and the fear out there.
Well, I would say the most important one to be mindful of are self-destructive behaviors. So when people become fatalistic, when they become anxious because of all the messaging, we start seeing an increase in the signs and symptoms of depression, and we see a higher risk of suicide. So again, coming back to I think the very important slide that Natalie showed, being aware of some of those early indicators is so important. You know, recognizing the signs in the members of your team that would indicate that they're moving into a potentially downward spiral and potentially self-destructive behavior pattern is extremely important.
Well, and I think reminding people that they do have some control, because I think sometimes that fear, that dread stems from they don't feel like they have any control over the pandemic or exposure or what's happening at work, but people do have some element of control. And so having that conversation of what can we control right now? We can wear a mask. We can not get too close to each other, et cetera.
Yeah, and you know, it's also part of having that bit of control. You know, giving people something to do that's meaningful is extremely important for managing stress. And it may be, you know, when people get a symptom and they don't know if it's allergy or cold or flu, them going off and getting a test, which is now pretty much, you know, the recommendation. If you have a suspicion, you get a test. You know, having some actions that you can take as an individual that can contribute to your sense of well-being for that moment is extremely important.
Great, thank you. And then one final question. Earlier in the webinar, the term active listening was mentioned. Could you explain in a little bit of detail, you know, the difference between active versus passive listening and why that's so important?
Yeah, I'll take that. Natalie, you may have a different answer than me. It's always fun to hear.
Okay, we'll see.
But I'll go ahead and I'll start. When we think about active listening, it's me inviting you or me showing that I actually am trying to take in what you're saying to me right now. I'm making eye contact. You have my undivided attention. Those are physical things that you can see. You know, like you know when someone's distracted. But if you as a boss are actively listening, you're making eye contact, you're in that moment, you've set aside other things to be able to focus on what you're saying, and you make the extra effort to then reflect back to somebody and say something back. You know, I understand that you just said such and such to me. Do I have it right? And that kind of engagement, just taking a few seconds to give people that feedback, is the crux of active listening. So I'm engaged with you, and I'm showing it because I just reflected back to you that I think I understood what you said. Sometimes you get it wrong, and they'll actually get a chance to then tell you, no, that's not exactly what I meant. And that's active listening. I'm glad somebody raised it because it's the crux of the word that we used earlier, which is empathy. And empathy is demonstrating that I have the listening skills and the ability to show you that I understand you and also measure that you're understanding me. And if you have that, that's the basis of almost every human relationship, is showing that we can make those kinds of empathetic connections. So I thank you for that question.
Thank you.
Yeah, I'll mention just that the Foundations for Safety Leadership training program, that's all the materials are posted on CPWR's website. That's one of the key skills taught in the training. And if you're interested in learning more about that, there are several case studies and scenarios that display how that's actually done on the job site. So I encourage you to take a look at that, because that'll help you learn a little bit more how to do that in the industry.
Very good. And thank you very much, Dr. Newman and Dr. Schwatka. We've got lots of great feedback from the chat. I think people really enjoyed this, and as well as the resources that are available. So also thanks to CPWR for hosting and for the hundreds of people that called in to participate. Thanks, everyone. Have a great rest of your day. Take care.